Alright, so guys, we'll be having another different type of leprosy today, and this is what they call the LL. Alright, some people abbreviate it as LL, but the full name is what? Lepromatous leprosy. So we'll be discussing this lepromatous leprosy today, and you guys will get to know everything you need to know about lepromatous leprosy. Okay, so you can see this is lepromatous leprosy. One of the characteristics is it is multibacillary. When they say that something is multibacillary, that means you'll be having more than 5 patches on your skin. All right, the patches on your skin will be more than 5. Then also, what's another characteristic? You'll be having foam cells. Okay, formation of foam cells, also known as virtual cells. Okay, so this lepromatous leprosy is multibacillary and is characterized by what? Polymorphic lesions. Okay, that's the skin, the nervous system are both severely affected by multiple lesions, which are what? Symmetrically distributed. Okay, so nerve damage occurs late, but the patient may suffer from a total loss of what? Sensitivity. Okay, so it says it's lepromatous leprosy. Okay, you see all those bulbs, right? They call them foam cells, right? I've already made a video on foam cells, right? If you want to watch the single video on foam cells, I could just get it for you. Okay, yeah. Another characteristic is leonine fascie. All right, leonine fascie means that okay, your skin is like bumping up like a lion. Okay, you know that another name for lion is Leo. Okay, so leonine fascie. Fascie is face. That means your face is looking like a lion. Do you understand? So in lepromatous leprosy, you have defined slightly hypopigmented macules on the extensor surface. The macules may coalesce to become raised and nodular, giving rise to what? A characteristic leonine fascia, whereas the ill-defined, slightly hypopigmented macules on the extensor surface, okay? And the macules, when they coalesce, they form this leonine fascie, okay? And underneath this leonine fascia is what we call the foam cells, okay? Your face will be looking like that of a lion, okay? So now these nodules may break down and ulcerate with resultant what? Seroanguinous fluid containing what? Numerous mycobacterium leprae, okay? Good picture showing leonine fascie, okay? Your face will be looking like that of a lion, okay? So now nerve involvement is minimal in the early stages, okay? So now that means you can feel for temperature, you can feel for light touch, you can feel for what? Pain sensation, okay? So but the nerves commonly affected in this lepromatous lepromatous leprosis were the ulnar nerve, radial nerve, supraorbital nerves, okay? And mixed with that reaction is what? Negative. You see this leprosy? Right, these are good images showing what? Lepromatous leprosy. So now the skin reaction in lepromatous leprosy. Now with skin invasion, bacteremia follows. Bacteremia is what? The presence of bacteria in blood, okay? And this bacteremia will persist during active disease, okay? With the organism multiplying within what? Macrophages, okay? So now from lymphatics, it can go to can spread towards regional nodes. It can spread to the bloodstream. It can spread to the what? Liver. The bacteria can also spread to the bone marrow. The bacteria can spread to the eyes. The bacteria can spread to the testes. Okay. So now there is a marked penetration of Schwann cells. Okay. So now virtual cells or the foam leprae cells are characteristics of this lepromatous leprosy. Okay. So basically, it's these visual cells underneath your skin that are basically forming all these bumps. I would say that they are macules. When they coalesce, they form all these nodules that, okay, form all these bumps. Forming these things, we call them leonine fascie. Okay, so one thing actually leads to another. The central nervous system is almost never affected in this type of leprosy, though. Right? So there is loss of what? Rate pegs and reduction of pigmentation in the basal layer. So there's also loss of what? Nasal septum. That means like you can continue the, I see how this nasal septum is going down. It's eating up inside. The cartilage is kind of like decomposing. So you might lose your nasal septum in this type of leprosy. So histologically, in the lymph nodes, there is proliferation of what? Histiocytic sinusoidal lining cells containing what? Mycobacterium leprae. Okay, so lymphocytes in the paracortical areas are what? Replaced by what? Histiocytes. Okay, so this is how it looks like. The histological stain slide, and you could see all those bumps. Okay, you could see all those bumps. All right, that's what the leonine fasces. All right, this is another histological stain for this word. Um, um, Lepromatous leprosy. Okay, guys, this is it about the lepromatous leprosy, talking about the definition, the characteristics, and reactions. Okay, all right, so that's it, and bye for now.